Little Falls is really where the Mississippi pauses. The river is really right in the center of our town. It's been a town that's lost a number of large businesses that took a lot of jobs away from our area. And I think for the most part, we're coming back from that. But most definitely that loss and that economic impact has made a big difference in the town and the community and really in our whole county. A couple of years ago, I really wouldn't have felt that we had an opioid problem. I think that we were all quite naive as to what was going on. 100,000 narcotic pills or substances were coming out of our 3 pharmacies in this community a month. Not a year, but a month.
We started seeing our prescriptions and narcotics showing up at overdose crime scenes.
So then the red flag really went up that we had to do something about this problem.
I feel our role in the community is to improve the health of the community we serve, be partners in the community we serve. As a hospital, going outside of our walls is important because we can't just be that place where people come when they are sick.
We applied for a grant focused on one target population, patients using narcotics for pain.
To be eligible for that grant, we had to partner with people in the community, such as law enforcement, such as public health, and that's really when all of those key stakeholders came together.
In January of 2015, the Morrison County Prescription Drug Abuse Task Force reconvened after being stagnant for several years. After grant funds were received, we could start the hiring process of the Controlled Substance Care Team.
Our Controlled Substance Care Team is made up of a number of people in our clinic. We have 2 physicians, Dr. Heather Bell and myself. We have a social worker, we have a nurse, and our clinic administrator is also on the team. Basically, our role is to help physicians monitor patients that are on chronic pain medications, to really look at why they're on their narcotics, what type of workup they've had, and whether or not we feel they're appropriate for medications. Our goal is to really do what we can do to help them with their pain, but yet decrease the narcotics coming out of our clinic. The difficulty of a program like ours is deciding who really uses the medication and who sells them. So we are intimately connected to the police.
So my role on the Prescription Drug Task Force is I'm the one of 2 law enforcement liaisons. And what we're able to do is take our knowledge from the street and we bring that to the group. I can arrest these people over and over and over, and I can throw them in jail. We really need to get these people into treatment.
We do everything we can to keep people out of our jail because that doesn't help anybody. You have to look at it as addiction, and we get them to treatment and we get them medications they need.
We actually started to see results with the Controlled Substance Care Team and the Prescription Drug Task Force collaboration early on.
Real concrete evidence that we're making a difference. I feel our specific model is working and we're having success because, we've kind of taken down those silos. We haven't tried to address it strictly from a hospital standpoint. We've really said, hey, we all own a little bit of this.
In the end, the less narcotics we prescribe on the front end, where we're going to save that money is not having so many people going through treatment, not having so many people in our jails, not having so many overdose deaths.
The CHI St. Gabriel's model works. It provided some of the answers that people all over the country are looking for. When I asked them to come out in Washington and make their presentation, we had a hearing room that was just jam-packed. Finally, someone wasn't just saying, hey, we got a really serious problem here. We found some people that have developed a model that we can follow.
We were told there could be as few as 8 or 10 people in the room, but 53 people showed up from almost every state in the union, including 4 staffers from the Senate. I think that this program is scalable, and I think the reality is, with the right funding, where we can have the right kind of people in clinics helping these patients, that it can be like what we have. And obviously, we had a grant to get this going, and we're looking at where we're going to get money to keep it going.
We have sustainability procedures that we're working on, but grant funding will be done after April of 2017. We'll have expended all the funds.
It's a small percentage of the population of Morrison County that we're talking about, but it really does affect our entire community and our entire county.
And it takes the whole community to fix the problem.